Patients who have heavy breasts can experience a number of problems such as neck and shoulder pain, shoulder indentation, a rash underneath the breast, and difficulty finding clothes that fit. A breast reduction procedure is designed not only to decrease the weight of the breast but also to improve the shape of the breast. And we do that in a number of ways. It involves surgically repositioning where the breast tissue is, so we move the breast back up onto the chest where it belongs. We also decrease the weight of the breast so that it literally takes the weight off the shoulders and the neck. Any patient who is experiencing problems with heavy breasts, such as shoulder and neck pain, shoulder indentation, rash underneath the breast, difficulty exercising or finding clothes that fit, they are going to be a good candidate for a breast reduction procedure. A breast reduction procedure is performed under a general anaesthetic. At the time of the surgery, I also put in a lot of local anaesthetic so that when the patient wakes up, hopefully they won't be in any pain at all. It does involve scars around the nipple, straight down on the front of the breast, and then a variable scar underneath the breast that no one sees. I put the wound back together with dissolving stitches. On top of the stitches, I put paper tape, and the patient then puts a bra on at the end of the procedure. Most of the time I do use a drain, which is a hollow plastic tube that comes out through the armpit. Normally that drain is removed the day after the surgery. The vast majority of times patients opt to stay in hospital overnight, but I can perform the surgery on a day-only basis if the patients want to go home and sleep in their own bed. In terms of the recovery after surgery, the patients can shower from the day after the surgery. I ask them to take it nice and easy for a couple of weeks, no swimming, no exercise, until I give them the okay. And that's normally about 3 weeks after the surgery. As with any surgery, there is some bruising and swelling afterwards, but all this tends to settle down after a period of weeks. Scars are permanent, but they do tend to settle down with time. The scars can be red, raised and lumpy for a couple of months, but then tend to settle down hopefully into fine white lines. The scars following a breast reduction tend to do particularly well with time. A breast reduction procedure normally takes between 2 or 3 hours. Patients normally stay in hospital one night, although they can go home the same day if they want. Patients can shower from the following day. They wear a bra with no underwire for the first 2 weeks day and night, just taking the bra on and off to have a shower. 4 weeks after the surgery, they can start wearing a bra again with an underwire. I advise all patients not to do any heavy lifting or any heavy exercise for a couple of weeks after their surgery. The main thing that patients notice after a breast reduction procedure is a decrease in the weight of the breast. This is obviously not something that you can see in a photo. What you see in the photo is the improved shape of the breast. So the nipple is lifted up and the breast tissue is lifted up onto the chest wall. It also means the breast does not droop or sag as much, and it gives an overall perkier appearance to the breast, which patients are delighted with when they look in the mirror.